Thank you, Kyle. Thank you, Sang. This is an interesting topic. Hopefully by the end of my talk, you'll have maybe a different take on what you were thinking before on this topic. Let's play Surgical Jeopardy. Which treatment for anal fistula dates back to antiquity? Is it the seton, the plug, the flap, or the lift? Wrong. If you read the works of Hippocrates, his favorite technique was actually one that required the insertion of a fresh garlic stalk through the tract. It was medicated, left in for about 3 to 4 days, and then replaced with a woven linen thread, also medicated. We don't know if it was successful, but given the short growing season of garlic in the Mediterranean, it was at best a seasonal approach. Hippocrates goes on to describe his alternative technique, which consisted of linen wrapped in horsehair, a tin probe, and a bolster bandage. He passed the probe through the tract, passed the linen and horsehair, interestingly enough, tied it over a knot, a treble knot, which is a slip knot, a fisherman's knot, over a bolster, and tightened it every day. So it was essentially fistulotomy by foreign body reaction and pressure, but he referred to it as a ligature, not as a seton. It wasn't until the 12th century that Roger Frugard came up with the term seton, and he essentially placed it as a loose seton made of either equine, bovine, or porcine hair, and then injected corrosives into the tract. So that's where seton came from. The advancement flap dates back to basically 1903. A surgeon from New York, Tuttle, who described essentially a fistulectomy taken through the sphincters. Then on the way back, he repaired the sphincters and closed the dead space and developed the flap, placed it over the orifice, the primary orifice, and then had his own proprietary type of drainage catheter. But this was the original description in 1903. The plug came about approximately about 2004. There's been various modifications. There are various types by different companies. And the L.I.F.T came about a few years later by Aaron Rojanosakal. Ligation of intersphincteric fistula tract, an attractive concept. Where it fits into the treatment specific